today, probably it's a bit more kind of specialized talk. We're not going to talk about basic preventive measures. We're going to talk about heart disease, blockage, and then try to help people understand what is the difference between different modalities, different techniques, and most importantly, that what can they do to make things better. So allow me by just going straight to the topic saying, tell me about the imaging techniques. How do we diagnose heart blockages?
Thank you very much. It's very, very common, Dr. Weil. People come to us and they say, how can I look into the blockages in the arteries of my heart? And in 2025, I can tell you that it's very easy that we can assess the arteries of the heart by simple imaging techniques. One of the simple techniques will be that we just do an imaging of the arteries of heart by doing a CT scan. What happens is, very simple test, easy, non-invasive, takes only an hour or so, and you will be discharged on the same day. We inject some dye or a contrast into one of your veins, and we take the images of these arteries. And to be honest, this test is so good now that the sensitivity of this test is more than 90%. And we can tell you with a very high predictivity that whether you have a blockages or not. And these techniques are so good in comparison to many of the other traditional non-invasive investigations like an exercise treadmill test. And as an expert, I believe that this is the modality that people should be aware that the CT scan or the calcium scoring should be done to look into the arteries. And I'll just go a little further that as an interventional cardiologist, what I do is I don't only look at the images for diagnosing. What we do is that we can plan these CT images and decide before taking someone into the cath lab and decide whether he needs what sort of tools, gadgets. We can plan whole procedure, even sitting in the clinic and decide what will be the outcome. So I really believe one of the common thing that we can do now is just do a CT calcium score and a CT angiogram to look into the blockages.
It's amazing. And honestly, thank you for this. And this is what I try to encourage my patients to do it, because now we can catch things early. It's really like if
you're right.
any minor work on the arteries, what I call it, I compare it with the street. So like if there's a road work that's starting to happen. So now we can catch those early things very early, which we could have missed on the stress test before.
You're absolutely right. And if we talk in the medical term, the sensitivity of a treadmill test is about 67%.
Oh, wow.
It's like switching the coin, like 1/3 of the people, it might give you wrong information. So one of the common or simple tests might be just do a CT scan and it will give you a lot of information.